Milwaukee's air quality has improved over last week, but Canadian wildfires continue to burn across Ontario, spreading smoke across the Midwest and Northeast United States. Dr. Ben Weston is Milwaukee County's Chief Health Policy Advisor. Weston spoke with WUWM's Eddie Morales about the effects of short and long-term exposure to wildfire smoke.
We had such terrible air quality at the end of last week. I mean, we hit well over 500, which is just unprecedented numbers for our region. It's the highest we've ever recorded in this area, in the Milwaukee County area. And so I think that was so bad and so extreme that kind of anything feels better now. So for most folks, this is going to be all right. But for people who do have lung disease, who have asthma or who have heart disease, this still may be weather that's going to strain their condition and make it worse.
How can wildfire smoke cause health issues exactly?
Yeah, so what happens when we have the wildfire smoke is we have these PM 2.5 we might have seen in the news or on the weather sites. And really what these are very small particulate matters that come in the smoke. And the problem is that when you breathe in, these are getting deep into your lungs and they can cause irritation and inflammation inside your lungs. And when it does that, there's short-term as well as long-term consequences to that. So most of us are feeling the short-term consequences of that. And certainly last week, it didn't matter what physical condition or what health conditions you have. If you were outside for even 30 seconds, you'd feel that your lungs were starting to burn. You might feel like you need to cough. Things just felt a little more uncomfortable. You might also notice your eyes were burning, things like that. And when you have those extremes, it hits you really quickly. Now, most of us aren't necessarily going to feel it. We'll see that it's a little bit misty in the air or a little bit smoky in the air. You might smell it a little bit, but it's not going to affect, especially just walking around, our respiratory status as much. But for kids with really small airways, especially really young kids like babies, for older adults with more fragile airways, and certainly with people who have that lung disease, where even a little bit of inflammation in their airways is going to cause a big change, they're still going to feel it. But those are short-term effects. We also have the long-term effects. And over time, chronic exposure to levels of smoke like this can not only worsen some of those lung conditions, but can actually cause them.
Yeah, and so what are the precautions that people can take both inside of their home or inside of a building, but also when people do step outside? And could you give specific recommendations on things like masks and air purifiers?
Yeah, absolutely. So especially when the smoke levels are getting higher and you're starting to feel the effects of it, there are certain things you're going to want to do. So staying inside is the easy one, especially if you have air conditioning or an air purifier. Now, we know not everybody in our community has that, and so the situation is going to be different for different folks. But if you do, that's a pretty safe environment. If you keep the windows and doors closed, you're running your air conditioner, you have a good filter in that air conditioner, or you have an air purifier that's running, you're going to keep a lot of that particulate matter, a lot of that smoke out of your house. And the same thing goes for a car. Cars can actually be one of the safest places to be if you have the windows closed, you have your air conditioning on, and importantly, you have it on recirculate, that little picture of the car with the circular arrow that we really never use and maybe don't even know what that does. That recirculates the air rather than bringing in new, fresh air from outside. And it's also a good time to check your cabin air filter to make sure that air filter in your car is actually filtering out some of this particulate matter. But some of us can't stay inside. Now, in those cases, you want to still try to minimize exposure. Sometimes that means going to public places where, like a mall or a library or a community center, where that air is filtered, especially to get out of the smoke. For others, it might mean a mask, especially people who are more sensitive to those high smoke conditions, or when the smoke just becomes so extreme like we saw last week. We saw a lot of people wearing masks. Now, one of the important things about masks is it really has to be a high-quality KN95 or N95 mask, and it has to be well-fitting. And really the sign of that is you shouldn't be able to smell it, because if you're smelling it, those particulate matters getting in.
If there's anything else that you'd like to talk about that maybe I didn't ask.
You know, whether it's smoke in the air, whether it's extreme heat, or in a few months, whether we're talking about extreme cold, just keeping in mind that not everybody has the same resources. And so reaching out and see how you can help make sure they're doing okay.
That was Dr. Ben Weston, Milwaukee County's Chief Health Policy Advisor. To learn more about air quality safety and how to build a DIY temporary air purifier, visit WUWM.com.